everybody. Welcome back to another I Care for Your Brain with board-certified neuropsychologist, Dr. Karen Sullivan. We are here to talk about brain health education and empowerment so you can make better choices if you are experiencing a brain health challenge. Today we're going to talk about our words, and there's 3 words that I really want you to reconsider if you are in dementia care. Our words shape our perceptions and our attitudes towards other people and concepts and entities, for better or for worse. They frame how we experience life and how we understand other people's experience. When we're talking about human beings living alongside a brain disease, aka dementia, we really need to examine some of our terms because they add unnecessary stigma to an already very challenging human experience. I believe that the lived experience of dementia, how it feels to be on the inside looking out, is made up of 2 parts. There is a biological brain disease that is happening and causing neurodegeneration, and there is stigma, and stigma is felt, stigma is internalized. And it's really time that we embrace a more positive, person-centered view of brain health. And what this is going to include is changing our vocabulary. And this is going to make sure that our community members, our neighbors, our friends, our loved ones are seen as the valued individuals that they are, above and beyond the impact of any disease. I'm going to tell you the 3 words that gotta go and what to replace them with. So this is how we're gonna do our part to evolve as a society. First thing I want you to think about is, how are people living with dementia or brain change often referenced? If you start to pay attention to this and cue in to common terms, you might actually be kind of outraged at the embedded negativity that is in many of our terms. So things like dementia victim, the person suffering with Alzheimer's disease, the dementia patient, right? So think about it. What is embedded in all of that? They're not people first. They are their diagnoses first. Their entire identity is medicalized into being a patient and not a person. A much better choice would be simply a person living with brain change, living alongside brain change. They are living, they genuinely have a neurodegenerative disease, but it is not their everything. It does not encompass their entire world. Even at the very, very end stages, if we focused our care differently, if we were trained and had more skills to focus on retained strengths in the humanity and the personhood that can still be found, we would see it differently, and we would understand that, man, we've actually taken a really negative view on dementia. And I'm not here to tell you it's a cakewalk, and I know dementia not just as a doctor. I understand it as a family member. I'm a very sensitive, emotionally compassionate doctor. I truly care about my patients. I understand when they're in pain, and I feel their pain. I don't just treat my people from up here. It comes really from inside me. And so I know that it's hard. It's maybe the hardest thing that we can face in this human journey, but gosh, there's a lot of room for improvement in terms of how we think and how we care. The second term I want you to get out of your vocabulary is senile dementia. We don't like this term because senile dementia implies that significant cognitive change, significant functional decline is a part of normal aging. And further, it suggests that young people cannot get dementia. We have early onset dementia before the age of 60. Many people are diagnosed with a neurodegenerative situation. Senile also is kind of negative. It implies like confusion and weakness. And by using these terms, we are reinforcing harmful stereotypes that disregard the idea that dementia is actually a very diverse emotional, psychological experience, and that there's wisdom and positive things that come along with aging. And the truth is that some brain diseases don't actually cause confusion, especially for the very long, mild stage, the second stage of moderate. And sometimes people will die with dementia with absolute awareness and insight into what is changing for them. So advocacy has actually been working on the word senility for a very long time. 1978 was the very first time that we started to say, maybe that's actually kind of a slur. Maybe it's kind of a negative word. And what's interesting is that this is tied to when we as American citizens specifically started to get access to our medical records. And it was devastating for older adults to read that they had been given a senile diagnosis. So alternative terms that were suggested at that time were things like maturity onset medical condition. Now, that is definitely a bit of a mouthful. In 2022, the World Health Organization attempted to replace the word senility in the International Classification of Diseases with old age, because they said senile is just too negative. However, there was pushback arguing that old age is also not a pathological condition and that this is just another term that would reinforce ageism. So we need to communicate that chronological age does not equal biological age. Physiological aging is actually very, very different for each person. And this can depend on a variety of genetic factors, societal factors. But we also want to hold space for this idea that getting older can actually be a real positive. There's so much literature to suggest we get wiser, our interpersonal skills get better, our BS meter starts to work a lot better, we don't invest in relationships that don't feel reciprocal, our vocabulary increases, our knowledge increases. So we really do have to remember in dementia, folks are getting hit with a double disability. So what I mean by that is you got all the stuff that comes along with ageism, and then you've got all the stuff that comes along with being perceived as someone who's incompetent, who's not the same person that they used to be. And these two things together are that changeable, fixable, man-made part of dementia that I have become so passionate about in the last year. So again, remember, dementia is not just something that happens to old people. You can have non-gray hair and have dementia. We think that the average age of early onset dementia is about 55, 56. So think of somebody that age. Think of how young you know that they are. The number of commercially insured Americans from age 30 to 64 who are diagnosed with early onset dementia increased by 200% from 2013 to 2017. So that's just one way of tracking diagnostic frequencies, seeing how many people in a given society are diagnosed. So increased by 200%. What do we think about that? So I'm actually going to propose that we replace the word dementia. I actually think it's kind of akin to the R word. We don't say that anymore because it got too caught up in negativity. There was no saving it. And I'm starting to feel more and more that that is also how I feel about dementia. It's such a heterogeneous group of brain diseases. It's just not really acceptable anymore because it comes along with so many negative biases and stigma. So we've done this before, you guys. Terms, medical terms, health terms, they get updated all the time. There's many examples. Again, going back to the R word, you would never even hear mental retardation anymore. We now say intellectual disability. We can do better. We can be more sensitive and avoid feeding in to anything that dehumanizes people living with a brain health challenge. Tell me what you think. Do you agree? Is it time to replace some of our key terminology in dementia care? What are some other ones that I didn't get a chance to tell you about today? We've actually created an entire list of words that I would like you to consider replacing, and I added why I think they need updating. So in the comments below, you're more than welcome to get that for free. We are trying to do egoless sharing here on this channel, which is you don't watch to build up to some membership thing or something you have to pay for. I do occasionally have things that we ask people to pay a fee for, but 99% of things on my channel you're always going to find to be completely free access. If I've learned it in here, I feel like you deserve to know it out there. Take care. Bye.